Good evening, everyone. It's a pleasure to welcome you here this evening. And as my colleague Rabbi Yoni says, it is certainly a very most important subject for us to be able to air in the Jewish community. Just a brief thought on the parasha before we move on to the official business. We read about the Pelishtim in this week's parasha, and the activity in which they were engaged was sitmum Pelishtim. They blocked up the wells. And Rav Adin Steinsaltz offers the interesting explanation is that this is not just merely a physical activity in which the Philistines were engaged, but it actually symbolizes an activity which is so common in life, blocking up that which would otherwise be open. If we are unable to function in a fully open way, if we are occluded, if we are hindered, then full expression can't be given to those personal resources which each and every one of us is potentially able of expressing. That stum, that situmum, that occlusion holds us back from maximizing the person each one of us could be. And this, of course, applies in mental health as it does in so many other areas of life. And the resources that our professionals this evening are able to bring to bear in their many areas of expertise help us in the community to open those wells at the Mayonot HaYeshua, the well springs of potential that each and every one of us has is being able to be expressed properly. What I plan to do is to introduce our panel members to you one by one. They will come up and speak about who they are, the expertise and experience that they have, and then we'll have a chance to ask some questions and have a bit of discussion on these very important topics. I'm going to begin with Professor Raoul Strauss. We've just seen that wonderful video of the Maine Hashua Hospital. And Professor Strauss, as you saw from the video, is the medical director of Maine Hashua and the mental health wing, and is one of Israel's leading psychiatrists. He's also a full professor of psychiatry at Tel Aviv University's Sackler School of Medicine, and he brings many years of experience into this area. So, Professor Strauss, if you can explain a bit about yourself and your work, and then we can engage later on in the evening with you.
It's a wonderful pleasure to be here, an honor. My chief rabbi in South Africa, I remember St. John Woods was the most prominent shul we were always told in England, and here I'm here in the most prominent place, and it's really great to be here. In the spirit of the words of Dayan Binstock, I thought maybe we would start off once again with something from the parasha. So in parasha we learn that Rivka was experiencing pain in her pregnancy, and then the Torah tells us she went to Lidrosh et Hashem. She went to consult. So what does it mean, Lidrosh et Hashem? What does it mean to seek out the Kodesh Baruch Hu with the pain of her pregnancy? So the Ramban says that Rivka, with her pain, was going out to seek relief. So what does it mean, relief? So the Yekev Ephraim says this kind of relief was not a physical pain, but was a mental kind of anguish that she was experiencing, because she didn't know what the future of the twins in her pregnancy was going to be. So the concept of the fact that there's mental anguish and that the mental disorders is not a new concept. It's something that's been around for a long time. But our approach to mental illness is very different today, because now we have treatment. So when the Gemara says in Perek Shvi of Masechet Gittin that lo sameh bi'adam, there's no treatment for mental illness, that's not true today. And that connection between how we understand through halakha what mental illness is and the reality today of what we can use with modern technology and science is very different. And that's why the connection between what goes on today in modern medicine and the Torah world has to be made. So I mentioned the story last night, but 3 years ago I was asked to teach some registrars, some trainees in psychiatry, what is research. I said, let's go do some research. So there's a group of 300 psychiatrists who were meeting, and we took the DSM, which is the Bible, the Torah of diagnoses in psychiatry, and only about 30 of them. It's not so sophisticated. And we asked these psychiatrists to self-evaluate themselves, self-diagnose themselves according to the DSM. So what percentage of these psychiatrists, these 300 psychiatrists in Israel, would say they had some form of mental illness? What percentage would you say? 5%? 10%? Okay, 89% of the psychiatrists said that some form of mental illness. I'm one of the 11% that's completely okay, but 89% said that some form of psychiatry. But not 5, severe, not 0, not 2 or 3, like a little bit. But do you think that's because all psychiatrists are a little off? No, that's part of the human condition. We all have a bit of depression, a bit of anxiety, a bit of personality, sometimes a bit of obsessive, sometimes sexual issues, sometimes sleep and eating issues. It's part of the human condition. And there's nothing to be ashamed of. The question is whether it affects function. And if it affects function, it becomes a focus of clinical attention, and then we need to deal with it. So approximately 2/3 of people at some form of their lives are going to have some kind of form of mental illness at some level of severity. But only about 1/3 of those are going to get help for that. And that's a pity, because those people really suffer. And it doesn't have to be like that. And really, what's the essence of that? It's a problem of stigma. And that's what we're saying, that it's nothing to be ashamed of. You can reach out and you can get the help, because stigma is a very negative thing. Why is stigma such a bad thing? People are not getting help. They're suffering alone. Their self-esteem is shattered, and it can intensify their sense of, or their feelings of depression. And it doesn't have to be like that. We should be able to reach out to people who could help us in those situations. But in the community, for some reason, it's become an issue. So the problem is that people with mental illness, we don't think about them, because we like put them on the side. In Israel, it's all over the world, but in Israel, what happens is that the psychiatry hospitals, and it may not be different here, but it's definitely similar to that in America, in parts of America, and for sure where I come from, in Africa, psychiatry hospitals are put on the side. So you have a psychiatry ward where there's 6 to 10 per room, one shower for 40 people. It's neglected. It's you know, when I go into the hospitals, you feel like you're back at home in Africa. It doesn't have to be like that, because patients with mental illness don't have a voice. So when you go to any big hospital in Israel or anywhere else around in the world, in the Western world, a general hospital, you walk into it looks like a hotel. But a psychiatry hospital is neglected. It doesn't have to be like that, because patients with mental illness don't have a voice. And even with us, as you know, we're very sensitive to the Holocaust. When we talk about the Holocaust, any city in the world that respects itself has a museum for the Holocaust or some kind of memorial. But what about for the mentally ill? Because that's where it all began, right? That's where it all began. It started with gassing the mentally ill. And only after a few years later, it started with the Holocaust, which began, in essence, in 1942. But the whole idea for gas chambers came from gassing the mentally ill, but we don't talk about it. And when you go to Yad Vashem, there's nothing here about the Jewish mentally ill, who they started with. They were the doubly cursed. Because at Yad Vashem, we deal with the Jews, not the mentally ill. But what about the Jewish mentally ill? Oh, we don't deal with that, because they don't have a voice. And that's the same thing when it comes to hospitals and services, because cancer and diabetes and multiple sclerosis and the medical illnesses are very important. And that's where a lot of the funds for infrastructure and for research is invested. But in mental illness, unfortunately, that's not where the funds are directed. And when we talk about the Holocaust, when we talk about the doctors, we talk about Mengele. But the doctor where it's all about was a Treblinka. And I'm sure many of you never heard of the name of Imfred Erbel. Imfred Erbel was the only doctor who ever ran a concentration camp. And not only that, he set up Treblinka. And he was the most successful of all concentration camp commandants. He killed 280,000 Jews in 6 weeks. No one even came close to that. And then they fired him because he didn't know what to do with the bodies. But how did he manage to kill so many people in such a short time? Because he'd already been head of 2 psychiatry hospitals as a psychiatrist, where he knew that if a doctor wore a white coat, he would let people would go and they'd trust the doctor and go into the gas chambers. But we don't talk about it, because mentally ill don't have a voice. And there's not a single memorial for the Jewish mentally ill anywhere in the world, because the Jewish mentally ill don't have a voice. And we think we should be for that. So why is that important to have some sensitivity for the mental illness? First of all, we have to know where we come from. And if people have issues, it's okay. It's okay, and it's okay to reach out, and it's okay to deal with it. And it's okay in a spiritual sense as well. When people have issues, you have to know where you come from and what you are about before you can start improving your spirituality. And that's part of the treatment. Sometimes it comes in when you've been culturally sensitive. When it says in the Pirkei Avot that you have to know where you came from and where you're going to, and that you're going to stand in front of the Kodesh Baruch Hu. So Maral asks, why would you have to just say, you're going to stand in front of the Kodesh Baruch Hu one day? Surely that should be it all that you need. Why do you have to know where you came from? But no, you do. You do need to know where you came from. You do need to know who you are and what your issues are if you want to grow and develop your spirituality. You can't deny oneself in a time of crisis, and that's what resilience is about. So part of the way that we approach mental illness is to say, you know what, in life, we don't have so much control what happens to us, but we have control how we deal with what happens to us. So whatever life throws at us, we make choices. And that's really what resilience is about. And resilience is about not so much necessarily that the damage has now been done, it existed. It just means that damage doesn't have to control your life. So when we deal with fracture and people have gone through difficult issues in their life, we help them build themselves up by saying, don't deny where you came from, but use that to move on. So living a life of meaning we encourage the transcendence, and that comes into our daily work with the patients. It's not just, okay, we're going to give medication and therefore we get out as soon as you can, because there's much more to the person than just doing that, and that the holistic approach to the patient is very important. So the essence of resilience, when you're dealing with people who've gone through trauma, and trauma is a big issue, it comes up in mental illness today from many different levels, both at the inpatient and outpatient level, is not so much dealing with the what, because we can't control the what, but it's a question of how we deal with the how I move on now, how I use where I am now, how I make the right choices to move on. And that becomes a very important focus of our spiritually based therapy when it's important. So why is that important to have cultural sensitivity for the person in the religious person? Because if you're in a context with that's we're sensitive to everything today. We're sensitive to the culture of this and the culture of that. But what about the religious sensitivity? So in Israel today, if you're hospitalized in a psychiatric institution, your family for sure can't visit you because everything's electronic today. You can't eat the food on Shabbat because everything's prepared. So we're going to say we're going to be sensitive to the religious individual at a cultural level, not just because of the physical and the Shabbat issues, but what about the spiritual-based approach as well? So that comes in a lot, as well as a biological approach, which obviously that's the first line of management today in any kind of first-rate psychiatric institution. So I like to ask a question, when I go into the panel, I say, how many of you ever visited a hospital for bikur cholim, for someone who had a pneumonia or broken leg or any kind of serious illness? How many people have ever visited a general hospital? I'm going to ask you, how many? Done bikur cholim. Okay, so how many of you ever visited a psychiatry hospital for someone who's not a family member, for not a non-family member? Relatively less, right? Why is that? Why do people don't visit? Why, psychiatry, we just, because why? Because you go in there, it's dangerous? That's not true. Many more people with mental illness are killed by so-called normal people than mental illness people with mental illness who kill others. It's not true. It doesn't have to be like that. Why can't bikur cholim be done? So, for example, when they have a bat mitzvah project where you want to visit someone sick, I encourage my daughter to adopt someone with a chronic mental illness, and schizophrenia in this case, and to visit for the year before the bat mitzvah. It's a very popular thing in Israel to adopt someone who's ill, but no one adopts someone with schizophrenia. Why would you not do that? Why? Because mental illness, we don't, It doesn't have to be like that. So our approach is to say, you approach people with mental illness with dignity in it, and those with mental illness shouldn't have substandard conditions. And I'm just going to end off, because I know time is a little limited. When you go into a hospital today, and it's something I mentioned also last night, you go into hospital and you can buy Coke from a machine right today, and that's a wonderful thing, because because next to that Coke machine is actually a flower machine, because now you can buy flowers and you can take to a person in a hospital. So in 25 years that I've worked in psychiatry, I've never seen anyone bring flowers to anyone in a psychiatry ward. Why is that? Why should that be? So I talk about that, and it's something that's very poignant, and it's a message for me to be sensitive to where people are at, because I can see my patients are not necessarily getting the care from outside, and we have to make sure our staff are doing that and to fill that void. So 6 months ago, around Pesach, the day before Pesach, I walk into the women's ward, and I see a lady walking around with flowers. I say, wow, I've been talking about this for the last few years, to say, well, I've never seen anyone bring flowers, and now I'm seeing flowers in a psychiatry ward. Isn't this a wonderful thing? So I go up to her and I said, you know what? I've been talking about this, and suddenly I see you with flowers. Isn't it a wonderful thing? Someone brought you flowers. And she said to me, no, you got it wrong. It's a day before Pesach. I'm stuck in a psychiatry ward. I have illness. I understand that. I can't be at home with my family. No one brought me flowers, so I got a pass. I went out and I bought myself flowers. So that, for me, once again, was something poignant and something even more poignant. And I'm saying people with mental illness are lonely with the fact that they have an illness. And it doesn't have to be compounded by the fact that sometimes us in the community don't reach out and say we recognize it and we're open to that. And we're living in a society where connections are not there. People become disconnected, and part of that's social media. Do you know in America today, they did a study, so they said 86% of people, Americans between the ages of 18 to 25, were dating 10 years ago. Today it's under 50%. So people are, why? Because they're stuck at home and they're not connected. So much less people are dying now from car accidents and drug overdoses, but much more are dying from depression and suicide. And because people are not connected. So I'm saying that we have to reach out. We have to be sensitive to people. You know that we talk about imitatio Deo, that we want to imitate the Kodesh Baruch Hu in how we respond to things. So we know in the parasha from 2 weeks ago that the Kodesh Baruch Hu was sensitive to Avram going through his pain and sent the three malachim to go visit. He didn't have to do it, but he recognized it. And Avram did the same thing, because he saw the three malachim out there and he ran out to them because he saw a need. So I'm saying that we have to be sensitive also to needs, that sometimes go out our way. When you see someone in shul who's sitting alone and someone who you know has gone through a difficult period, how often do we actually take that initiative, like the Kodesh Baruch Hu and Avram, to reach out to those people? And I think that that's something as a community we should take upon ourselves, because there's no loneliness like there's a loneliness of someone suffering from mental illness. And I'm probably preaching to the converted, which is really why you're here today. And I thank you for being able to share that with you.